Hello, and welcome to this Help Me Grow virtual networking breakfast. I am beyond excited to be here. My name is Colleen Murphy, and I am the Vice President of Early Childhood Community Systems Building for Start Early. So I wanted to start by giving you a little bit of information about Start Early and who we are. Get this to advance. So Start Early is formally known as the Ounce of Prevention. You may know us under that previous name. We are a nonprofit public-private partnership advancing quality, early learning and care for families with children before birth through their earliest years to really help close that opportunity gap. And we envision a world where every single child has an equitable opportunity to reach their full potential, to thrive in school and in life. For nearly 40 years, Start Early has delivered best-in-class doula, home visiting, early Head Start, and Head Start programs. We bring in expertise in program delivery, research and evaluation, professional development, and policy and advocacy. Start Early works in partnership with communities and other experts to drive systemic change so that millions more children and families and educators can thrive. You can learn more about us at www.startearly.org. So why am I here today? Well, there are many opportunities around us, opportunities for funding that will really strengthen our early childhood work. I have been asked today to share a couple opportunities and to really share some stories of impacts and progress. And then you can network together and see if there's anything that's been that comes to mind of ways that you can be working toward one of these opportunities. So I like to say the opportunities are all around us. Are we ready? Are we ready to meet those opportunities? So there are 3 opportunities that you can see on your screen here, and these are opportunities that are currently open right now. We have the Promise Neighborhood Program. Now that deadline for submitting an application is October 7th, and it's really all about working in our distressed communities to improve education and developmental outcomes for children. There is an early childhood component to this opportunity. There's also the HRSA Healthy Tomorrow Partnership for Children program. That deadline is October 12th. And finally, there is preschool development grant renewal. Now, this is only open to some specific states, and you can see here on this list that Utah is one of those states that's up for renewal. Now, one challenge that I often see is that when these funding opportunities come out, the window for submitting an application is usually very short, a very fast turnaround. And in my work across the nation, I've learned that the people that are the most successful in getting these opportunities funded are those that are obviously the most prepared. So these people, they haven't waited for these opportunities to come out. Rather, they are continuously having conversations and brainstorming ideas and innovative ideas, and even drafting some language well before it is needed. This has been very, very useful for them, especially when fleshing out those innovative ideas. Because when these opportunities drop, they can automatically start putting in this pre-populated language right into the opportunity. So to spark your creative juices, I've been asked to highlight some work that's happening across the nation. So let's look at some of these stories of progress and impact. So I'm going to start in New Jersey. Now in New Jersey, their South Ward Promise Neighborhood, with that funding, they were able to support a single mother of 5. Now this mother was struggling to get her kids to school on time every single day. She did not have a car, and so her children would have to ride 2 buses a day to get to school. And that only could happen if she had bus fare money, which, as you can imagine, was not all the time. So she didn't have that money. Her children had to walk to school. And as a result, they were showing up to school late, and they were missing this critical class time. They were missing some important instruction, and they were really falling behind. So the success mentor for the Promised Neighborhood, she arranged for daily transportation to school at no cost for the family. She coordinated this entire pickup process. She would call and let the mother know when her children had been picked up. She would call and let her know when the children had been dropped off at school. And then she even went the extra mile and would meet the children at school every day so they would see a friendly face before heading off to class. Now, these actions of just getting the children to school before the bell rang had huge impacts. It actually made an immediate impact on their schoolwork, and these children began to excel. Now, I will tell you, when I worked for the Utah Department of Health and was over the home visiting, statewide home visiting program, we heard this all the time, that there were places that families needed to be. Well child checks, even trying to get them to summer reading programs at the library, or even getting to the store was a huge problem because they did not have transportation needs. So I just ask you, are there innovative opportunities regarding transportation in your communities? Is there something that you could be doing, working together to support transportation needs in your community? Next, I'm going to tell you about Philadelphia. In Philadelphia, the Promised Neighborhood, again, and Drexel University, they wanted to improve healthy eating and nutrition learning. So they started providing nutrition education to help children identify healthy eating and physical activity options. They created some very simple key messages, and they drafted a child and adult nutrition curricula. But then they did some other really fun things. They hosted taste testing events where they would just pop up around the community with food that people could come and taste. They started a recipe sharing program, and they started running after school cooking clubs, getting children after school learning how to make healthy snacks and how to cook. And they ran a community garden. Now, in this community garden, they would take that produce and they would distribute it. And they typically donate about 15,000 pounds of produce a year. I think perhaps my favorite part of this is, as children are growing up and getting this nutrition and information, then they take the teenagers and they offer a summer internship for teenagers. So not only does this help peer-to-peer mentorship, but it also, gives these teens something to put on their resume. They have some funds that they get to collect. So it's really, this has been this win-win program. So I am curious, are there places in your communities where they would benefit from some innovative nutrition education, or perhaps easier access to some fresh produce? Next, I'm going to tell you about the Illinois Children's Mental Health Partnership. Now, this partnership brings together state agencies, parents, youth, policymakers, providers, and advocates to develop and oversee the implementation of their children's mental health plan. So they all came together, they created this mental health plan, and this group has provided the venue for state leaders and other stakeholders to build relationships, share information, and think collectively about how systems can work together to better serve children and families. Now, working together, they have made progress on several of their goals, including implementation of social and emotional standards, statewide expansion of screening and support services, and increased public awareness of the importance of mental health. And this is something that's just so near and dear to my heart, is social and emotional development, and this building relationships for all of us to have better mental health. Now, one of the key areas that they explored in this action plan was how Illinois could implement a mental health consultation program across systems, which in and of itself, I'm sure you would agree, is complicated because everybody has, each program is very unique, and they wanted to have some sort of framework to bind them together, which would allow for variations to allow to accommodate for the needs and practices of different sectors, but would be a consistent model. So right now they're piloting this model. It is being piloted in home visiting work, in child cares, and in preschool. So what are you doing to strengthen mental health for infants and young children? Is this perhaps an area where you could come together and work stronger to support the mental health of infants and young children? All right, the last one I'm going to share with you is the Valley Settlement Project in the Roaring Fork Valley, Colorado. Now, this aims to work very collaboratively with new immigrant families to improve outcomes for children and parents by increasing their connections to the community. So project staff interviewed 270 immigrant families to really go deep and to hear about the barriers that these families were facing in terms of securing employment, enrolling their children in childcare or preschool or elementary school, connecting to community services. And these conversations revealed that many immigrant families felt isolated and unsure how to navigate the various systems that are there to help them. So recognizing the interrelatedness of many of the problems families were experiencing, program and project staff decided to take a whole family approach to addressing the root cause of the family's difficulties. And they came out with several two-generation programs for these immigrant families. A couple that just really stood out to me, they have a Learning with Love. This is a evidence-based infant, toddler, and parent program that helps parents learn strategies to promote their children's healthy development. It's near and dear to my heart because my doctorate, I did a community-based child parent program through Conscious Discipline. So, and I just had great success with this. So I know that parents are typically very excited to participate in things that will help them have better relationships with their children and to be a more successful parent. After the parents, the immigrant families participated in that program in Roaring Valley, the parents reported that they knew better how to keep their children healthy and access community services. Again, they did a group cooking class, and this was wildly successful. People coming together, cooking together, breaking bread together, was really a successful, it continues to be a successful thing for these immigrant families to find other people in the community to have relationships with and get some mentors and some peers that they can connect with. And most importantly, it provided healthy eating and mindfulness and exercise. So this idea of teaching families how to be mindful was very, very successful and continues to be successful. The participants have reported that they feel decreased stress and they feel more ready to have healthy activities. And the project also offers community-based adult education and leadership opportunities. So since the Valley Settlement Project began, the level of school readiness among the immigrant children has improved. It is going up, which is great. It's awesome. And the educational achievement for the immigrant parents has also increased. So they're having some great success there. The participants have also reported that they have been able to obtain better jobs and they feel more valued and really they feel like a valued member of their community. So I know that, Utah is a refugee state. We have a lot of refugee populations. So are there opportunities to work with immigrant or refugee populations in your community? There's also a big migrant Head Start population. So is there an opportunity there to come together and to collaboratively do something together that you can't achieve on your own? So those are a couple different stories of success. And now I want to share some advice. And this advice I'm sharing comes from someone who reads a lot of these funding opportunities. In fact, I am sitting on the Promise Neighborhood grant. I'll be reading those applications. So I thought it might be helpful if you heard some advice on what we look for when we're reading applications. I know people are tired of hearing it, but the first thing we look at is, is there a focus on high quality? Now, having said that, a lot of people think it has to be evidence-based high quality, and a lot of times it does. But, don't be afraid to make room for new things that you're just trying out. And a lot of times if there's a balance there, that, hey, we're exploring this new idea while we do this high quality thing, then a lot of times you will be successful. I also highly recommend that you make it as easy as possible for families to access services. So is there a way to locate multiple services in the same place? That makes it easier for families to use the service. So if you think about it, a lot of times now you'll see in a grocery store, you can register to vote, you can do your taxes, you can get immunizations. They're really trying to center as many things in a common place as possible. A lot of people are doing Promise schools where they're locating well child checks and other things in a school. So how can you locate multiple services in the same place? Next, I just highly recommend, it's all about the relationships. So today, at these tables where you will be networking, develop partnerships with public and private sector leaders. I find that the majority of the applications that I read, there is a requirement to have memorandums of understanding, MOUs, some sort of written agreement in place. And a lot of times people are running around at the last minute trying to get some actual letters to submit with applications. And you don't have to wait for that. You can be working on that now. You can be forming these partnerships and really seeking ways to work together. And community commitment comes first. So any type of change effort, including a neighborhood-based one, it's a massive endeavor. And one of the most important pieces to address first is community input. Does the community want to be part of your neighborhood-based initiative? I actually had a really good lesson in this when I worked for the Department of Health. When I was over the home visiting work, we had a rural community that they just could not fill their home visiting slots. So we took a trip out to this little rural community to really try to figure out why here's this great program, doesn't cost you anything, why aren't you using it? And it actually turned out that the model that was being implemented in that area was not one that the community supported. It didn't meet their needs, therefore they weren't using it. And so, it was just as simple as listening and giving the community the power, and then presenting to them some new options that ended up being a much better fit for the community. Another thing I always like to tell people is do your best blue sky thinking. Dream big during planning. I have read some applications in the past that just have these really big ideas. And I often Often we can't fund the whole thing, but we can fund part of it. Or you know, they'll say, hey, let's do this in phases. Let's roll out different pieces of this. So don't be afraid to do that. Dream big. We love to read an application with some big blue sky thinking. And I have to say, embrace innovation. I think there is a very real idea out there that we've been trying it the same way for years, and we haven't been getting the results always that we are looking for. So if there's something, if the old way, old strategies or programs have not demonstrated success, then don't be afraid to try something new. If a new service or support is desired, but it's not available, work together with your partners to create it. As a side note, I will say anytime that you're trying something new, it is sometimes uncomfortable for people. Not everybody embraces change. I know people say they're okay with change, but I don't see that that's always true. It's not always the case. So really think about how you can embrace innovation, but always think about how are you going to take the people you are working with through a change, some sort of change management to manage that transition. Also, one of the requirements of pretty much every grant I've ever read or applied for wants you to identify outcomes and measure project progress. So right from the beginning, I encourage you to identify goals or intended outcomes, but also the data that you will use to measure that progress. And then something I just don't see often is that the data is being shared regularly with partners, and it's being used daily to really inform decisions about whether to continue, revise, or stop a particular program or effort. It's my experience that most people shun data. They're not comfortable. They don't want to collect it, or they're collecting it just to check a box, but they're not using it. So I encourage you to think about every meeting, I encourage people to use data and to do some sort of data walk, whether it's a one-on-one supervision, whether it's a community meeting, or a family council. I don't think it matters. Use data and get people more familiar with the data, and you will have you'll have much better success. And then I hope this goes without saying, but partner with parents. Every parent, I don't care who they've been in the 30 plus years I've been doing this, every parent tells me they want their child to succeed. Now, often their definition of success might vary from the other people in the room, but they all want their children to succeed. And initiatives are more likely to succeed if they meaningfully partner with families to support their goals as parents and to support them in advocating for their child's needs. So one thing that we look at often when reading applications is we are looking to see, is there just a parent there as a sort of a token representative? Is there a strong representation of parents? I would say one parent on an advisory board or a committee, you know, typically we don't recommend that. We recommend 2 or 3 or 4 so that they can really have other people to talk to and to relate to them and to help support the voice. And then finally, start somewhere, not everywhere. This work is overwhelming. There's always so much to do. We're always thinking about how can we best help children and families thrive. And sometimes that work can feel overwhelming, but just know you don't have to start everywhere. Just start somewhere. Start today at your tables as you're networking to think of, you know, what are 1 or 2 things you'd really like to accomplish and move forward. So with that, that's my best advice, and I hope this has been informative. I hope this has sparked your desire to work together to be ready for these funding opportunities. If you have any questions or need a thought partner, I am happy to help you. You can email me at cmurphy@startearly.org. And if you ever need a national person to sit on your board, or you need just that national lens, or a local lens. I mean, I'm here. I very much would love to be a part of your work and to help you on your journey. And with that, I will turn it back over to Help Me Grow. Thank you.